My name is Mike Anderson. I'm one of the instructors for the Climb program in healthcare interpreting. I teach the introduction to healthcare interpreting, and I also teach the summarization and the certification for medical interpreting. I've been in the field for the last 15-20 years. I have worked as the program manager for healthcare interpreting at Kaiser Permanente. I developed the policy and procedures for healthcare interpreting at Kaiser. Healthcare interpreting is an important aspect of providing medical terminology, medical care for patients who do not speak English or who have limited English capabilities. The role of the interpreter is critical in making sure that the patient is guaranteed the same level of care and access that an English-speaking patient receives in both the clinical setting as well as the hospital setting. Even if you speak a second language at home, even if you've done a lot of interpreting in family situations and other types of situations, the reason that you need to take this class is because it's a profession. It's a medical profession, and it's being recognized as a medical profession. That's number one. Number two is, which is really important, is that there's a body of knowledge that goes along with being a medical interpreter that is unique to being a medical interpreter. And within that, there are even specialties within the medical profession, such as hospice, such as psychiatric interpreting. So there are a lot of nuances that go into this. This course is set up so that you will have the ability to do it all online. Sometimes it'll be once a week, sometimes it'll be multiple times a week. As an instructor, I'm visible to you as to the rest of the class. You'll have the opportunity online to ask questions, both written and verbally. And then there'll also be assignments and sometimes videos online for the students. Well, before you take the course, I think it's important, number one, to have a good grasp of your second language. That's obviously a very critical point of this course. The other point that would be important for you to know is what's involved in being a medical interpreter. Most of that is covered in the class, but I think it would be wise to do some research beforehand to find out whether or not this is the kind of thing that you would like to do. You might even want to shadow another interpreter, or you might talk to another interpreter who works in the field. But I think the preparation is important because a lot of what's involved in being a medical interpreter involves your passion to be able to do a good job for the patient and for the provider. I think some of the things that will be challenging are some of the topics that you may not be familiar with, like anatomy and physiology and medical terminology. I think one of the other ones that you might be challenging to you is actually being in the medical interpreting setting and trying to adjust to that kind of a situation. And then thirdly, the challenge will be just to stay on task and making sure that you really have a passion for this. And I can't stress that enough. The passion, you can learn the process, you can gain the knowledge, but you really need to have a passion for what you're doing. And that is really critical, and that goes into what you really need to know before you start the course. The reality is that the field of medical interpreting is expanding, and the amount of knowledge that's being required is expanding. The complexity of interpreting is getting to be more difficult. Interpreters are being used by professionals much more than they used to, and so the complexity within the different specialties is getting more difficult. So there's a lot more knowledge and a lot more breadth to being a medical interpreter than there used to be. That is the reason why Climb has a higher level of hours that's required for it. And to be honest, 60 hours or 40 hours is just not enough to learn a profession. And I'm really pleased to be associated with Climb because it does offer longer hours, and it's better to the student in terms of what they get out of the program. It's better to the students for being able to get a job when they come out of the program, and it's better for the employer to know that they came from an organization that is providing a higher level of training. And I say that the students that come out far exceed their expectations, and they are far better prepared than just interpreters who have not gone through the program. And they have lots of interpreters who go out there and just do interpreting. But without that training, they really can't call themselves a professional interpreter.